Post-traumatic stress disorder is a very serious and debilitating illness. It's in the anxiety family, and it usually is something that happens after somebody is exposed to a life-threatening trauma, or they've witnessed a life-threatening trauma. And this could be anything where someone's life might be in danger, such as a physical assault, a rape, physical abuse. But most recently, of course, we're hearing a great deal about it from people who are coming back from war zones where they've witnessed great things. And it can even be in normal range things like people having an auto accident can experience a post-traumatic stress disorder. Well, that's a little bit of a mystery. What causes post-traumatic stress disorder to occur, people usually have an exposure to a life-threatening trauma or have witnessed it. Sometimes just witnessing someone getting killed can cause you to have post-traumatic stress disorder. And then a subset of those people who witness such a thing or experience such a thing will go on to experience post-traumatic stress disorder. Those people often then will experience flashbacks and nightmares, and they'll want to avoid situations where the flashbacks or nightmares might come about, and they'll experience increased physical arousal, heart beating fast, sweating, palms, thoughts racing, just when they're in the situation where the physical trauma might take place again. Any of us are at risk for post-traumatic stress disorder, especially if something happens to us, and we never know when something might happen. But some traumas are more traumatizing than others. We know that natural disasters are not as traumatizing for most people as a man-made disaster like an act of terrorism, and more people will go on to develop post-traumatic stress disorders in those situations. Also, people who have experienced post-PTSD or trauma in the past are more likely to go on to develop post-traumatic stress disorder. The major symptoms for the disorder, they're basically broken down into two basic categories, and that's arousal and avoidance. And the arousal symptoms are typically things like flashbacks, heart beating fast, surges in energy, sweating, palms, and other types of symptoms. And the avoidance symptoms are things like emotional numbness, avoiding situations that might lead you back to the trauma, avoiding movies about certain things, avoiding going to an airport if you had a serious experience on an airplane, or to avoid movies about an airplane, or to avoid pictures about an airplane, or to avoid even talking about airplanes or flying. And so people can express it in many different ways. Post-traumatic stress disorder is highly treatable, but it's a difficult treatment because people generally have to talk about what they've been through. Some of the treatments involve exposure, and that involves something like group therapy where people talk about what they've been involved with, and typically having a group therapy with other people who've been exposed to the same thing can be very helpful, and people help process it together. We see this especially with vets who come back from the war, that doing such a thing is quite helpful. There's a type of psychotherapy called cognitive behavior therapy that works with stress disorders and anxiety disorders quite well, and it's worked quite well with post-traumatic stress disorder. And there's a type of therapy called EMDR, which involves exposure to the trauma and talking about the trauma and doing some kinds of different bodily functions in the theory that might help process the trauma as well. Also, medications are available that can be quite helpful. To find out more information about post-traumatic stress disorders, you can go to a great website, the Anxiety Disorders Association of America website at www.adaa.org. That's www.adaa.org. And to find information about me, you can go to my website at www.drgreg.com.